It's Matt Miller, 1460 KXNO. Ken's still on vacation. He'll be back on Friday. It was a lot of fun during the first 2 hours talking to Austin Renat and Zach Spears from the Iowa State football team. And, well, we are now joined by Dr. Stephen Grant, our friends from the Iowa Sleep Disorder Centers, the proud sponsors of the Matt Miller Studios. Dr. Grant, how are you?
Great, Matt. Great to be back. Thank you.
Are you an NFL fan or are you a college football fan?
College football all the way.
So are you a Hawkeye fan? Are you a Cyclone fan?
Colorado Buffaloes, CU Buffs.
So are you?
We're in transition.
I was going to say, do you like where your program is going?
I like where it's going to go.
Were you a fan of Dan Hawkins?
Well, yes and no. I mean, I think he had a pretty tough road, and the recruiting classes have been kind of weak, but with Eric Bieniemy coming back into the equation, I think they're going to get some strong recruiting classes and build Colorado back up to a force.
Is that the big news that he's coming back home?
I think so. I mean, he was part of the magic there, and having his name back, as well as the way McCartney had built the program up back in his tenure, it's kind of looking into the past as prologue, I think, and people are excited about it, and I think it's a good thing.
Yeah. What's interesting is that I thought they would give the old coach the job for a couple of years. I thought they might have a transitional period.
Bring Mac back?
Yeah.
Yeah. I think he's a little bit too polarizing for Boulder on some of his
political views?
Yeah, political views to say the least. Boulder's a little bit of a conservative town. My tongue is firmly pressed to my cheek on that statement. But I don't think Mac would get the type of ringing endorsement from the Regents and the other players. But with that being said, you have to think that Eric Bieniemy paid attention to a lot of what he learned there, and he was a great assistant in the NFL too. It's going to work out well.
I'm sure the Vikings were bummed to lose him. So, all right, we're going to talk about liquid here. This is I have a personal anecdote, and then we have a topic that we want to get into.
Are you going to overshare today?
I'm not going to overshare, but I'm just going to talk about, I love asking you about sleep because I feel like I've got an expert here, and my own sleep is something that I think about sometimes, so I like to kind of get your take on it. And I wake up so thirsty in the winter, and I keep my house at like 68. I mean, it's not like it's overly hot or overly dry. Is that just me, or is that I got to go buy a humidifier, or is that a normal kind of sleep issue when it comes to winter that people are waking up dehydrated?
Yeah, I mean, you bring up a good point. Simple physics, you speak about how moist air can be with colder air not being able to hold moisture as well. When the wintertime comes along, the air is drier, can be more uncomfortable to breathe. People can have dry heat in their house. People do end up, more often than not, either utilizing humidifiers in the wintertime, trying to add humidification to their furnaces. It can certainly be a problem. And I know a fair number of people that sleep with a glass of water by the bed. And we'll frequently hear the parallel of, boy, I get up to use the bathroom a lot, and that's kind of annoying for me.
Yeah, that's kind of where we want to go with that. So for me, I'm not abnormal if I'm sick. I do sleep in the wintertime with water by my bed. It's just something that I do, but once a night I'll roll over and drink.
Humans prefer to breathe humidified air.
So it's not totally abnormal.
You're not abnormal.
Well, if you go even further to that line and you're getting up to go to the bathroom, which tends to be sort of a question for a lot of guys these days. It's, why am I getting up? Why am I being woken up by my body, tapping on the brain saying it's time to get up? How big of an issue is that becoming for men?
Well, it can be kind of confusing in the realm of sleep medicine because more often than not, men will just put it off on the prostate. They'll say, this is just my prostate getting bigger. I'm not emptying my bladder fully, so it'll be full more often, and I'll go to the bathroom more frequently throughout the night. But I'm always given pause when I do see, especially younger men come in, that you classically wouldn't associate with enlarged prostates that have prominent episodes of, for lack of a better term, peeing a lot at night. Our fancy medical term is what we call nocturia, or nocturnal urination. And I can actually explain to you some of the pathophysiology behind a common problem I see, obstructive sleep apnea and nocturia. I'm often given a puzzled look by my patients when they say, explain how that's connected. But the pathophysiology is rather straightforward and understandable.
Which is?
Well, long story short, obstructive sleep apnea, the rough paradigm is intermittent hypoxia or lack of oxygen in your lungs. And the lungs are a pretty smart organ. They sense when they're not seeing air, and they'll redirect blood flow to areas of the lung that are seeing air. But it can get a little bit tricky, Matt, when none of the lungs are seeing air. And the lungs can get kind of confused about where to shunt blood to try and get gas exchange, which is what it does. And some of this blood ends up getting back to the heart. The heart stretches a little bit. And if you thought the lungs were smart, the heart's even smarter. And it senses that there could be a little bit too much in the way of preload. And it generates, for lack of a better term, a neurohormone that tells your brain and your kidneys that it's time to urinate, and you're actually offload urine, all as a consequence of not being able to ventilate your lungs the appropriate way.
We're with Dr. Stephen Grant from the Iowa Sleep Disorder Center here. I'm Matt Miller on 1460 KXNO. That's a whole lot more complicated than you would think. Of this, I gotta go to the bathroom.
Well, it's kind of neat when we do treat guys for obstructive sleep apnea, and one of the first things they'll innocently say to me is, "Wow, I'm not getting up over the course of the night having to go to the bathroom. Is that normal? I didn't change anything about my medications." And we'll often bring it up at that time.
And tell them this is what's going on. Is there a way of sensing that? Or you know, if you're a 40-year-old guy, you're kind of on that cusp of either side of maybe it could be your prostate or maybe it's not.
Sure.
Is that where you guys would recommend somebody coming in and talking?
Absolutely. I have a number of very smart urologists in town here that I work with that routinely make it part of their workup when guys go in and say, geez, I think this is the best place for me to start. And the urologist will often say, well, we'd also want to make sure that you're doing okay at night when you're breathing to rule out that possible cause of nocturia. So I work closely with some of the urologists here in town. It's known in the medical community, but to some of those 40-year-old guys out there, it's a little bit of a stretch to say, hey, sleeping has something to do with having to go to the bathroom all night.
How much is too much in your mind in terms of going to the bathroom? I mean, is it once, twice, 3 times? I mean, if a guy's thinking, I get up once a night.
I'll give anybody once a night if they're ingesting enough liquids earlier in the evening. And you have to think that what goes in has got to come out. So you want to control for people that are just ingesting a lot of liquid in the evening. But more often than not, I find that clinically the threshold is 2 to 3 episodes of having to get up and get out of bed, especially when it confounds that person's ability to get back to sleep. You know, they get up to empty their bladder, and then they get back to bed, and they can't fall asleep right away. And they start to notice that it kind of adds up over the course of the night and really affects their total sleep time.
Interesting. We're Dr. Stephen Grant of the Iowa Sleep Disorder Center here on Matt and Miller on 1460 KX. So just a couple more minutes with Doc. And does the types of liquids you're consuming factor in at all? I mean, if you're drinking energy drinks or coffee or soda or other types of beverages, does that factor in rather than just straight water?
Sure, absolutely. Some beverages, especially beverages that contain caffeine, have natural diuretic properties. Caffeine in and of itself can act as a diuretic. So, I mean, we generally like to supplement, unless you're in strenuous sports activities, with just regular water is fine. But most men will even try and scale back their liquid intake prior to bed, thinking that there's some connection there, that maybe I'll get up to use the bathroom less if I ingest less water, when it still brings to bear that even if they greatly reduce the amount of liquid they drink prior to their sleep period, they're still getting up over the course of the night, secondary to their obstructive sleep apnea.
Doc, before we let you go, this is the time of year where people are making New Year's resolutions, and they're starting to think about, what will 2011 be like? Do you see more people coming in after the first of the year trying to become healthier, or they're willing to take a more active role in their sleep?
Absolutely. I think that the approaching wave of baby boomers, we call it the silver tsunami, is really kind of getting a sense of agency over their own health, or understanding, especially in the changing landscape with medical insurance and health insurance in general, that preventing conditions from getting worse or identifying them earlier in the course is something that people are curious about and invested in, and that has a huge impact on referral to our sleep lab.
So if it's insomnia, if it's sleepwalking,
obstructive sleep apnea and sleep quality affects multiple comorbid illnesses. You talk about hypertension, you talk about diabetes, you talk about psychiatric disease, depression, anxiety, as well as just people just from a lifestyle standpoint feel fatigued. It all kind of is connected.
So if you're looking about, well, I'm going to get in the gym, maybe there might be something else you need to look at as well as overall body health.
Yeah, and sometimes I'm the upstream variable from that. Sometimes getting the sleep disorder treated will give people the necessary amount of energy or motivation to take that next step and get involved with the exercise program.
Very interesting. If people want to get in touch, Doc, how can they do so this coming December into January into the new year?
They can call our offices directly. There's no physician referral needed. You can self-refer to our clinic. We see patients 6 days a week. We have office hours in the evening and on Saturday. Again, you don't need a formal referral. You can self-refer to our center.
Doc, thank you. It's always great catching up.
Thank you.
Dr. Stephen Grant here. I'm Matt Miller on 1460 KXNO with the Iowa Sleep Disorder Center. Coming up next, Gabe DeArmond, PowerMizzou.com. We'll check in with him with Iowa and Missouri as the bowl game for the Insight Bowl gets a little bit closer, about 3 weeks away. It's Matt Miller, 1460 KXNO.